Good day, everyone. Welcome to our LT3 exam rationalization for Nloa 1. And I'm actually in charge of discussing the answers of the first two sets of this nursing practice tool, the care of healthy at-risk mother and child, specifically focused on D1 care of pediatric client with respiratory disorders. Let's begin with the first 12 questions. The first question is, a 6-year-old child is admitted to the emergency department with an abrupt onset of high fever, difficulty swallowing, and drooling, and is maintaining a tripod position. The nurse notes inspiratory stridor and a muffled voice. Which nursing intervention is the absolute highest priority in this situation? A. Administering prescribed intravenous antibiotics and corticosteroids. B. Preparing the child for a lateral neck radiograph to confirm the thumb sign. Or letter C, assessing the back of the child's throat using a tongue depressor to visualize the epiglottis. Or D, maintaining the child in the position of comfort and preparing for immediate airway management. So we know that the patient here is actually having epiglottitis, which is considered to be a serious inflammation of the epiglottis that might result into a supraglottic obstruction. And it is considered to be an emergency. So from the situation, there is already this high fever, there's already this difficulty swallowing, and there's presence of drooling. So in this case, there's no need for the patient to be on an assessment. So the question here is intervention. Therefore, we need to answer with an intervention. Letter A, that requires a doctor's order. Letter B, that requires also a doctor's order. So therefore, the best answer for number one is letter D, maintaining the child in a position of comfort and preparing for immediate airway management. So the child is required to be in that position because that provides the most comfort and at the same time security. So it is also very important for the nurse to be available and be ready to have an immediate preparation for the child for possible endotracheal intubation. So it is a crucial decision for the nurse in order to prepare the patient for this specific procedure. So the best answer for number one is letter D. Number two, a 4-year-old client with cystic fibrosis is prepared to eat breakfast, which includes non-fat yogurt and toast. Pancreatic enzymes have been prescribed for the client. The nurse ensures that the pancreatic enzymes are administered. A, mixed with the child's cereal and milk. B, mixed with the warm mass toast. Letter C, within 30 minutes of eating meal. Or letter D, crushed and mixed with applesauce to ensure easier swallowing. Of course, when you're answering a question, if there are actually options that has the same words being used, eliminate them immediately. A, B, and D are eliminated because of the word mixed. Because if you're actually administering a pancreatic enzyme, it should not actually be mixed with anything, whether it is hot or cold, because that might actually going to have an impact regarding the effect of the enzyme. So letter A, it should not be mixed with cereal because we know that cereal and milk requires to be warm or hot, and then mixed with the warm mass toast that's also warm, then that might destroy the effect of the pancreatic enzyme. So the best answer for number two is letter C. So we know that when you're going to be giving a patient with pancreatic enzyme, it should be given within 30 minutes of eating a meal or a snack, because that will actually going to ensure that the effect of the enzyme is actually not affected. And if you are actually giving an entirely coated pancreatic enzyme, it should actually not be crushed, or it should not actually be chewed, because of course that will actually be dissolved in the intestine or in the GI tract. So number two, the best answer is letter C. Let's proceed to question number three. The nurse is assessing a 3-month-old infant hospitalized with a respiratory infection. The nurse notes that the infant is breathing primarily with the abdomen and has equal anterior, posterior, and transverse chest diameters. Based on the pediatric anatomy and physiology, the nurse correctly interprets these findings as A, signs of impending respiratory failure. B, expected normal findings for an infant of this age. Letter C, evidence of chronic respiratory obstruction, barrel chest, that is specifically for COPD. Or letter D, an indication that the infant has transitioned from nose breathing to mouth breathing. Of course, we know that that is a 3-month-old infant. So if you're talking about the infant and at the same time toddlers, they're typically abdominal breathers. So the chest circumference of the newborn is considered to be circular because the anterior, posterior, and transverse diameters are considered to be equal. And the chest reaches adult proportion ratios by 6 years. And of course, the patient here is 3 months old, and expected that the infant breathes through their noses until 3 to 4 months of age. So the best answer here is that is unexpected findings. Take note, letter A negative because that means that there is respiratory failure. Letter C, that's also negative because you're talking about COPD. And then letter D, it's not yet a transition because of course the change of the breathing pattern is usually going to occur at the age of 6 years old. Number three, the best answer, bravo. Number four, a nurse is preparing a 10-month-old infant for a thoracentesis. To position the infant correctly for this procedure, the nurse should place the infant in which position? A, sitting upright with arms and trunk bent forward. B, semi-recumbent position lying on the unaffected side. C, side lying position with the affected side up. Or D, supine position with the head stabilized. Of course, when you're talking about thoracentesis, the position that is required is actually varying according to age. So, sitting position with the arms and trunk bent forward is required for a child, but since that is considered to be an infant, so letter A is for considered to be for a child. So it's the 10-month-old is considered to be an infant, so that's actually going to be wrong. And then since that's thoracentesis, you need to expose the thorax. So side lying is actually going to be wrong. And of course, supine is also going to be wrong because that will actually going to be not exposing the thoracic cavity. So the best answer for number four is letter B, semi-recumbent position lying on the unaffected side. So that is actually on the unaffected. So as well, both if you are going to be draining both sides, then you have to shift position. But then again, as what I mentioned before, if there are two options with opposing answer, one of which is actually correct. Letter C is affected, letter B is unaffected. So we're focusing on the unaffected area. So number four, the best answer is bravo. Number five. A nurse is assigned to care for a 5-month-old infant who has tested positive for respiratory syncytial virus or RSV via nasal washing. The nurse is also assigned to care for a 3-year-old child who is immunocompromised. What is the most appropriate action for the nurse to take regarding patient assignments? Letter A, wear a gown, gloves, and mask when caring for the infant, but continue with both assignments. B, request a transfer of care for the infant with RSV to another nurse. Or letter C, avoid assigning nurses to care for other high-risk individuals when caring for the RSV positive child. Or letter D, limit the number of personnel and visitors coming in contact with the RSV patient infant. Of course, letter D, eliminate because we focus on the immunocompromised. Because we're limiting the number of personnel, especially for the immunocompromised, because we're talking about the reverse isolation. And then if you're actually talking about letter A, so wrong, it's also wrong because you're assigned in both patients. Remember, that's a viral infection. So it might actually infect the immunocompromised 3-year-old child. And then the best answer for number five is letter C because you are supposed to assign one nurse for RSV positive and one nurse as well for a 3-year-old immunocompromised patient because that's basically one way of isolating the child and at the same time making sure that there will be no cross infection. Number five, the best answer is C, 6. A 10-year-old child with moderate persistent asthma performs his peak expiratory flow rate reading and obtains a result that is 45% of his established personal best volume. The nurse determines that this result falls into which zone and requires what immediate nursing action. A. Green zone, continue routine scheduled medication. B. Yellow zone, administer the prescribed bronchodilator and reassess. Letter C. Red zone, administer the rescue medication and transport an emergency facility. Or letter D. Red zone, schedule follow up with the physician within 24 hours. Of course, if you're talking about 50% or below, that is considered to be on a red zone. So we know that the red zone is defined as when the highest volume that is achieved is actually below 50% of the personal best volume. So if that is actually a red zone, it signifies that there is a serious airflow obstruction, and that also requires medical intervention in that case. So here, the best answer for number six is letter C. Letter A and B is actually not the best answer because you're talking about 45%. It should be more than 50%. You can consider it at a yellow zone. So that's the best answer. Number six, the best answer is letter C. Letter D is wrong because you are not supposed to wait for 24 hours before follow up, because that usually requires an emergency rescue medication such as the bronchodilator. Six, Charlie. Seven, a 9-month-old infant is hospitalized with bacterial pneumonia and is experiencing tachypnea and respiratory distress. The nurse elevates the head of the bed but avoids using an infant seat. The rationale for avoiding the infant seat in this client is A. It increases the infant's anxiety and respiratory effort. B. It makes pulse oximetry monitoring inaccurate. Letter C. It increases the risk of aspiration if vomiting occurs. Or letter D. Pressure may be placed on the diaphragm, inhibiting lung expansion. Of course, when we are talking about respiratory distress, our priority is not about psychologic. We're talking about physiologic function. So, eliminate natin kaagad itong letter A. And eliminating natin itong letter C because vomiting is not our priority here because there is presence of respiratory distress. So our priority is to make sure that there is actually lung expansion that is actually promoted. So letter B also is going to be eliminated because that's not our focus. Our focus here is to make sure that there is going to be promotion of lung expansion. So we need to make sure that we are going to avoid the infant seats because this may provide pressure uh, on the diaphragm, which will actually inhibit the lung expansion. Rather, and then it will actually have an impact to the respirations of the infant. Number seven, the best answer, delta. Eight, bronchiolitis, commonly caused by RSV, primarily affects children under the age of 2 years. The nurse understands that the primary mechanism leading to symptoms in bronchiolitis is A. Thick mucus formation, including the large airways or the trachea and the bronchi. B. Severe inflammation and swelling of the epiglottis, leading to supraglottic obstruction. C. Inflammation of the bronchioles, causing thick mucus production that impedes expiration. Or letter D, an inflammatory response leading to decreased chest wall muscularity. Of course, we know that bronchiolitis is an acute viral infection and that basically affects the bronchioles, and there is a production of thick mucus that usually occludes the bronchial tubes and small airways that will actually impede expiration. So if there will be problems of that, then air becomes trapped behind the obstruction and leads to progressive overinflation of the lungs, and that is causing emphysema. Letter A, that is causing about bronchitis, and then we're talking about bronchiolitis here. Letter B, that is epiglottitis, and then of course letter D, that is actually talking about pneumonia. The best answer for number eight is letter C. Number eight, letter C. Number nine. A 5-year-old child has a positive Mantox skin test result. The physician orders a specimen to confirm the active presence of Mycobacterium tuberculosis. Considering the child's age, what is a preferred method for obtaining a specimen for culture and smear? That's 5-year-old. A. Sputum specimen collected when the child first awakens. B. Nasopharyngeal swab for viral culture. C. Early morning gastric washings. Or letter D. Tracheal aspiration during bronchoscopy. Of course, since we're talking about presence of Mycobacterium tuberculosis, eliminate natin kaagad itong letter B because that's viral culture. We're talking about tuberculosis, that's a bacteria. And then, of course, not a 5-year-old cannot actually spectorate a sputum. So letter A is eliminated. So we're talking about an option here that is specific for uh, a preschool because sputum collection is common in adults. And of course, for children who are likely to swallow any mucus from the lower respiratory tract that is produced with cough. Therefore, what is best for the child is an early morning gastric washing because that is the preferred method to obtain a specimen for culture. And tracheal aspiration is actually not a the best way for this one because you're talking about bronchoscopy here, but we're talking about gastric washing. Number 9, Charlie. Number 10. A 7-year-old client with cystic fibrosis is experiencing respiratory exacerbation and copious thick uh, purulent sputum production. The child reports being exhausted from coughing. What type of medication should the nurse instruct the parents to avoid administering? A. Antibiotics. B. Mucolytic. C. Bronchodilator. Or D. Cough suppressants. Of course, a child with cystic fibrosis has a very thick uh, purulent sputum, so therefore you need to give the patient with mucolytic and at the same time bronchodilator. And since most of the time there will be pneumonia for these patients with cystic fibrosis, you give antibiotics. The best answer is letter D, cough suppressants, because it will inhibit the expectoration of secretions, and that actually promotes infection in children with cystic fibrosis. So number 10, the answer is letter D, cough suppressants. 11. A 15-year-old adolescent has undergone pulmonary angiography, which post-procedure instruction is most critical for the nurse to reinforce with the patient and family. A. Increase fluid intake to help clear the dye from the system. B. Monitor the insertion site for white stools for the next 72 hours. Letter C. Remain on bed rest for 12 to 24 hours after the test. Or letter D. Expect a grating sound when palpating the insertion site or there's presence of crepitus. Of course, if we're talking about pulmonary angiography, it is expected that there has to be presence of bed rest for a period of 12 hours to 24 hours because that is basically required after the test. And it is expected as well for the nurse to observe if there's catheter insertion site inflammation or presence of hemorrhage or hematoma. So for white stools, that is for letter B, that is expected for patients post procedures if you're talking about barium swallow or barium enema, but not angiography. And then letter B eliminated. Letter A, that's not with the use of a dye. Usually, if you're talking about graphy, that is no dye, that's radiologic uh, test only. But we're talking about our dye, you talk about gram. And if there will be presence of crepitus, then that is actually presence of an issue regarding tendons and ligaments. 11 is letter C. 12. The parents of a 2-year-old child called the clinic stating their child has a common cold with fever and restlessness, which home management instruction is appropriate for the nurse to give based on standard pediatric care guidelines for acute viral nasopharyngitis. Is it letter A? Use a cool mist humidifier or increase humidity in the environment. Letter B, begin a scheduled antibiotic for 10 days to prevent secondary infection. Letter C, administer a decongestant as prescribed since the child is over 6 months old. Or letter D, administer an antihistamine to help dry up the nasal discharges. Remember that is home management. Therefore, you should not talk about medications. So the best answer is letter A. B, C, D are talking about medications. So answer alpha. So if there will be an increased humidity, it will be helpful for acute viral nasopharyngitis. And of course, when there's presence of this viral nasopharyngitis, one of our most significant nursing intervention is to encourage fluids and at the same time maintain hydration. And if ever there is medication, so antihistamines and antibiotics are considered to be not recommended for treatment for viral infection. And if you're talking about decongestants, it will be given for children over 10 years old or 6 months old, over 6 months old. And of course, what is very significant here for home management is about humidifier. A is the best answer. So let us proceed now to the next part, which is basically focusing on D7, which is care of pediatric client with genitourinary disorder. Let's begin with question number uh, 75. A 2-day-old infant is being monitored in the NICU based on the understanding of functional differences in the pediatric renal system. The nurse recognizes that this newborn is at a significantly higher risk for metabolic acidosis due to A, the short length of the loop of Henle, resulting in dilute urine. Letter B, inability to produce ammonium ion during the first several days of life. Letter C, reduced hydrogen ion excretion and plasma bicarbonate levels at birth. Or letter D, glomerular filtration and absorption being insufficient until 2 years of age. Of course, we know that if you're talking about newborns and that is in the NICU, that's 2 days old, they're more susceptible of metabolic acidosis, and that's because of a problem of hydrogen ions and hydrogen ion secretions. And of course, that's also very significant to talk about acid secretions and plasma bicarbonate levels at birth. So letter C is the best answer for number 75. When we're talking about letter A and letter D, that is describing for dilute urine and insufficient functional capacity, respectively, while option B is the inability to produce ammonium ions, which occur during the first several days of life. 75 is letter C. Next, number 76. The nurse is preparing to administer an oral cathartic the evening prior to the intravenous pyelography for a 4-year-old child. The nurse recognizes that this preparation is absolutely contraindicated if the child has a history of A. Hydronephrosis, B. Acute pyelonephritis, C. Hypospadias, or D. Chronic renal failure. Remember, the child here is actually 4-year-old. And then, if you're talking about cathartic, that is usually uh, administered the evening before the procedure. However, if you're talking about intravenous pyelography, it is expected that it is contraindicated for the child which has a chronic renal failure. Why? Because in that period, with CRF, there is this presence of hyperphosphatemia. So if there is presence of hyperphosphatemia, that is going to have an impact regarding the levels of calcium. So ABC eliminated. Best answer for number 76 is delta. Next, number 77. A male adolescent requires urinary catheterization. The nurse has cleansed the area, lifted the penis for a 90-degree angle to the body, and applied 5 to 10 ml of 2% lidocaine solution, a lubricant, into the urethra using the applicator. Which critical step must the nurse perform immediately next to ensure effective anesthesia? A. Wait 2 to 3 minutes before inserting the catheter. B. Hold the end of the penis closed for 2 to 3 minutes. Letter C. Retract the foreskin again with the non-dominant hand. Or letter D. Advance the catheter 1 to 2 inches immediately. Of course, the correct answer here is letter B. So for male children, after you have been after you have applied your lubricant, you have to make sure that the nurse uh, must hold the end of the penis closed for 2 to 3 minutes before proceeding, and that will allow time for the lidocaine to take effect and reduces discomfort that is associated with catheterization. While choice letter E is specific for an instruction that is for a female procedure waiting time, and you should have retracted the foreskin prior to administering the lubricant and advanced 1 to 2 inches once urine has flowed in your ureter bag. 77, the best answer is Bravo. 78. The parents of a male client with cryptorchidism are receiving education about the condition. The parents state that they are opting to wait past the first year to surgical correction, which is orchiopexy, because they read a testis may spontaneously descend. The nurse must stress the surgery is necessary before 2 years of age, primarily to prevent which irreversible complication? A. Potential for physical or psychological trauma due to an empty scrotum later in life. B. Increased risk of tumors due to exposure to body temperature. C. Increased risk of infertility due to exposure of the undescended testes to body temperature. Or letter D. Closure of the processus vaginalis to prevent future hernia. Of course, we know that it is expected for the child to have surgery prior to 2 years old, because if there will be an exposure of the testis to body temperature, it can lead to an increased risk of infertility. Although there is an increased risk of tumors, but the issue of exposure to body temperature is actually not causing the tumor, but that is focused on the infertility. And option D is actually uh, a reason for surgery. And there is this descending of the testis after the first year of life. 78. The answer is letter C. 79. A 6-year-old child presents with a periorbital edema, dark smoke-colored urine, and hypertension. The nurse anticipates a diagnosis of acute post-streptococcal glomerulonephritis, which dietary instruction is most critical during the initial oligoric phase of this condition. A. Encourage foods high in fat and carbohydrates. B. Encourage a regular diet with no added salt. Letter C. Avoid protein foods due to azotemia risk, or letter D, avoid high potassium foods. Of course, if the child has glomerulonephritis, the patient should have to avoid anything that contains higher in potassium, especially on the oligoric phase. And then the nurse also encourage a regular diet with no added salt and avoid protein, especially for patients with azotemia. And of course, potassium restriction is very vital during the oligoric phase because of the danger of electrolyte imbalance and associated with severe renal conditions, and it might also have an interference or result for the development of arrhythmias or dysrhythmias. 79, the best answer, delta. 80. An infant scheduled for urine culture and sensitivity test using a urine collection bag after cleansing the genital area and rinsing, drying the skin around the meatus. The nurse should next: A. Apply 3 soapy cotton balls to the genital area. B. Place the infant on a diaper and obtain a minimum of 20 ml. Specimen C. Place the bag around the urinary meatus or around the scrotum and firmly secure the adhesive. Letter D. Cleanse the area with 3 povidone iodine swabs. Of course, when we talked about the next step to do is for the application of your collection bag in infants requires washing hands, cleansing the rinsing area, and drying the skin. The next step is to remove the adhesive on the back of the urine collection bag and place the bag around the urinary meatus on the female and around the scrotum of the male and firmly secure it with adhesive. For option A is done earlier in the cleansing process, and for option B, that's done actually after the bag is secured and the specimen is collected. Then when you're talking about option D, it is used for catheterization, not urine collection bags. Number 80 is letter C. 81. A 3-year-old child is admitted with nephrotic syndrome and significant generalized edema, or there's anasarca. The nurse is monitoring the child's clinical presentation and potential complications, which finding is least typical of initial assessment for nephrotic syndrome compared to glomerulonephritis. A. Periorbital edema that is worse in the morning. B. Decreased urine output that is dark and fruity. Letter C. Normal or decreased blood pressure. Letters D. Irritability and pallor. We know that nephrotic syndrome is characterized by a decreased or a normal blood pressure. But for glomerulonephritis, there is hypertension. So if you're talking about glomerulonephritis, hypertension is there. So options A, B, and D is common findings for nephrotic syndrome. Number 82. The best answer for number 81 is letter C. 82. The nurse is reviewing the blood chemistry results for a 1-year-old child admitted with dehydration and suspected renal impairment. The nurse notes the following results: BUN of 20 milligrams per deciliter, creatinine 0.8 milligram per deciliter, potassium 5.5 milligram per liter, which finding requires immediate further investigation based on the child's age. A. BUN of 20, creatinine of zero point 0.3, potassium 5.5, or the combination of all three values. Of course, we know that the normal value for BUN for a child, especially for less than 1 year old, is 5 to 18. And a value of 20 is considered to be an elevated value, and that could suggest renal disease or possible presence of dehydration. And the normal creatinine is zero point 0.3 to zero point 0.7 milligrams per deciliter, and zero point 0.3 uh, is considered to be normal. And the potassium is 4.1 to 5.3. And as there's going to be slight elevation, but the BUN elevation is the clearest indication of probably the presence of acute pathology that requires needing investigation. 82, the answer is letter A. 83. A nurse is teaching parents about preventing urinary tract infections in their 8-year-old daughter. Which piece of instruction provided by the nurse addresses the most common conditions influencing the onset of UTI? A. Ensures she wears cotton underwear daily, instruct her to wipe from front to back after voiding, encourage her to completely empty her bladder when voiding, or ensure she avoids bubble baths and perfume soaps. Of course, we know that that is actually an 8-year-old kid. So the most common influencing factor for UTI is urinary stasis, that is brought about by presence of an incomplete bladder emptying, or there's presence of dysfunctional voiding, or sometimes due to anatomical abnormalities. Therefore, if you are instructing the child on the importance of completely emptying the bladder, that will directly addresses the primary cause for the UTI. And A, B, and D are considered to be extrinsic in nature for UTI that is brought about by hygiene. Answer for 83, C. 84. A child diagnosed with acute renal failure is experiencing severe hyperkalemia for potassium of 7 milliequivalent per liter and cardiac arrhythmias. After securing cardiac conduction with calcium gluconate, the nurse prepares the next step to actively reduce serum potassium levels, which strategy is used to transport potassium from the extracellular to intracellular fluids and elevate the pH. Administer prescribed kyaxylate enema, administering prescribed sodium bicarbonate, administering prescribed mannitol, or administering prescribed glucose and insulin. Take note, what is written is to shift the potassium from the extracellular to intracellular, and at the same time to elevate the pH. So definitely letter D is eliminated. It's good if you're answering insulin because that will actually help in opening the cell. But if you are actually talking about letter D, glucose should not be given because it will have an impact to the insulin effect as well. Then for mannitol, that is for inducing urination, and then you only give kyaxylate enema, especially if there's an excessive amount of potassium from the body. And there's no need for that one because the concern is basically potassium, not your uh, not specific. That's actually potassium, but that's not specific for kyaxylate here because it will not actually elevate the pH. Best answer for number 84 is Bravo. Administering prescribed sodium bicarbonate because that will actually help in the shifting of the potassium from the extracellular to intracellular, and at the same time that will help in addressing the metabolic acidosis the patient is experiencing. 84, Bravo. 85. A 7-month-old infant has been diagnosed with bladder extrophy. The parents are being supported by the nurse as they await surgical closure, which a nursing intervention should the nurse caution the parents against using? A. Covering the exposed bladder with clear plastic wrap. B. Providing psychological support to the parents. C. Applying an adhesive dressing to secure the exposed mucosa. Or D. Monitoring for signs of infection. Of course, should not man caution the parents against using. The best answer is letter C because you are uh, when you're talking about the coverage that is requiring, uh, you are supposed not you are to avoid adhesives or petroleum jelly because it may damage the bladder mucosa. Instead, the nurse should cover the bladder with a thin dressing or a clear plastic wrap. So letter A, letter B, and letter D is considered to be correct. But what is wrong here is applying an adhesive dressing to secure the exposed mucosa. 85 is letter C. 86. The nurse is managing a 14-year-old female patient diagnosed with chronic renal failure. The physician has ordered supplementation to manage nutritional deficiencies and bone health associated with CRF. Which group of vitamins should the nurse ensure is avoided for supplementation? A. B vitamins and vitamin C. B vitamin A, E, and K. Letter C, folic acid and iron. Or letter D, vitamin vitamin D. Of course, when you're talking about this one, as much as possible, you are supposed to avoid fat soluble vitamins because it may actually accumulate. So the best answer here is letter B. We need to have vitamin D because that will actually help in the in raising the calcium levels in the body. 86, bravo. I think this is my last number. A nurse is preparing to administer desmopressin to a child for nocturnal enuresis. The nurse reviews the child's medical history and notifies the healthcare provider immediately if the chart indicates a diagnosis of A. Attention deficit hyperactivity disorder, B. History of post-streptococcal infection, letter C. Cystic fibrosis or renal disease, or letter D. Vesico urethral reflux grade 2. Of course, if you're talking about desmopressin, we're talking about problems of diuresis because there might actually be fluid and electrolyte imbalances such as hyponatremia, and there also presence of water intoxication. So in this case, the best answer is letter C. 87 is letter C. So I think that's it. Congratulations, everybody. Thank you very much. See you again next time.